Good afternoon, and thanks for being here today. I'm Paul Erwin, Dean of the UAB School of Public Health, and I'm excited to welcome you today to the Fall 2023 Career Conversation with alumnus Dr. Corey Wiggins. Dr. Wiggins serves as the Delta Regional Authority Federal Co-Chairman after being confirmed unanimously by the U.S. Senate in early 2022. Nominated by President Biden in December 2021, Dr. Wiggins became the 5th Delta Regional Authority Federal Co-Chairman to serve in this position. A native of Hazelhurst, Mississippi, Dr. Wiggins most recently served as the Executive Director of the Mississippi State Conference of NAACP. Additionally, he served as Senior Vice President of Policy at Hope Enterprise Corporation and Hope Credit Union, Executive Director of the Mississippi Economic Policy Center, and as Director of the Hope Policy Institute, where he focused on strengthening communities, building assets, and improving lives in economically distressed parts of the Mid-South. Dr. Wiggins completed his undergraduate studies with a BS in biology from Alcorn State University before pursuing an MSPH in health policy and a PhD in health promotion and health education here at UAB. He also holds a certificate of nonprofit leadership from Boston College and furthered his training through fellowships with the Kaiser Family Foundation, the W.K. Kellogg Foundation, and the Massachusetts Institute of Technology. Dr. Wiggins, thank you so much for joining us today. Really glad to have you back here. Before I jump in and ask you questions about your career, which is the focus of our time here, I'm sure there are a few folks in the room who may not know about the Delta Regional Authority. And so perhaps maybe some people might know of the Appalachian Regional Commission. And so can you give us a high-level overview of the DRA and how it's similar to and maybe different from the ARC?
Sure, no problem. Delta Regional Authority is an independent federal agency. It encompasses 252 counties and parishes across 8 states. Those states include parts of Alabama, Mississippi, Louisiana, Western Tennessee, Western Kentucky, Southern Illinois, Southeast Missouri, and the eastern parts of Arkansas. Our mission and our purpose at DRA is really focused on economic development. How do we support job creation, job retention across some of the most economically dispersed communities in the country? How do we support workforce or do workforce investments to support families and people getting into family-sustaining jobs? How do we think about the nation's or the region's infrastructure, whether we're talking about water and sewer, and how we make investments in that to really support communities and thriving communities? So we do a lot of different things. What makes us unique is as an independent federal agency, in my role as federal co-chair, I co-chair the board with a state co-chair, which is currently the governor for Illinois, Governor J.B. Pritzker. All of our governors across our 8 states also sit on this board as well. And so in addition to co-chairing the board, I'm also serving functionally as CEO of the agency as well. And so we're very expansive in the work we do, and I know we'll talk more about that in the connection to public health, but that's part of our work. We're very similar to Appalachian Regional Commission. Alabama, Mississippi, and a couple other states have the unique distinction of having multiple federal regional commissions that operate in their state. Actually, Alabama has 3 federal regional commissions that operate here.
And the third one being?
Southeastern Crescent Regional Commission. That commission covers parts of the Carolinas, Georgia, Florida, and the southeastern, southern part of Alabama. The other, just for background in federal regional commissions, the other federal regional commissions include the Northern Border Regional Commissions, which covers the northeast part of the country, states like Maine and upstate New York. You have Denali Commission, which covers the whole state of Alaska. The newest commission is the Southwestern Regional Commission, which cover parts of like southern Mexico, South Texas, New Mexico, southern Arizona. So regional commissions are a group of independent federal agencies that really focus on placemaking in those respective areas in which we serve.
Great. Thank you for that, that description. So let's talk about you. What does a typical day look like for you? Is there any such thing as a typical or normal day?
There is not a typical day. Today, as a matter of fact, I think on my drive over, so I live in Mississippi, born and raised there, and on our drive over today, this is a day trip for me. The past 3 hours I've been working on testimony. I have to testify before Congress next week regarding the work and effectiveness of federal commissions. So on my drive over here, I spent the whole drive. One of my team members, Matthew Campbell, I think he's somewhere around here in the room, working and putting together testimony.
He was driving.
He was driving. But working on testimony for next week in front of Congress, I think next Thursday. But the day ranges with the work that we do, because our work is really diverse and vast. We are a grant-making agency, so as I mentioned, we invest in water and sewer projects, economic development projects in the region. We invest in workforce development training. Our health programming, we operate a J-1 visa program across our region, helping get physicians in the physician shortage areas. We operate a program with HRSA that focuses on working with struggling rural hospitals across our region, where they come in a cohort model, get technical assistance to support them, get them positive cash flow. But it ranges from the way that I would describe, I think, sort of the components of our work in my day is there's a part of the work that I have to do where I'm representing the administration out with investments, lifting up the work we're doing from the administration around equity, lifting our work up around climate resilience and across the region. There's a part of the operational work to run an agency. Our annual appropriations in our agency is about $30 million, but we receive an additional $150 million through the bipartisan infrastructure law. So what does that mean for us is over the past year and a half, I've had to steward our agency for being an agency of doing maybe about anywhere from $20 to $22 million in grant making to now doing almost $50 and $60 million in grant making. So that's part of our day-to-day. In addition to working with our congressional delegation. So we have an office in Clarksville, Mississippi, whereas our corporate headquarters has been there for the past 22 years, and also have an office in D.C. And so that means I spend a lot of time traveling the region, but also traveling back and forth to D.C.
Great. I'm really glad to hear of the work that that the DRA is doing to help support rural hospitals. I know in Mississippi, as in Alabama, we're really challenged with this and have experienced several closures, which just devastates these local rural communities.
Yeah, it's a regional issue. The unfortunate reality is when we look at some of the challenges in the areas we serve in southern Illinois to some of the challenges that exist in the Black Belt region, Alabama, while the places are different, the challenges are very similar. Our region, the DRA region, has the highest rates of rural hospital closures across the country. And so a lot of our work, while we, right, from a public health framework, think about quality of care, if you sort of think about it from an economic development frame, in most rural places and communities, the largest employers in those areas are going to be public schools and the hospital system. And so when a hospital closes, there's an impact on healthcare and health outcomes, but there's a direct impact on the economic viability of that community. So our leaning into that work, based on where we are in DRA, is that it's also an economic issue. And even when you think about how do you bring industry to a place, one of the first questions that people ask is about your healthcare system. and whether or not you have a healthy workforce, because it has, indirect impacts on business and business processes. So it's all of these connections that make, to me at least, make perfect sense.
This economic impact of hospital closures is so important, and I'm so glad that you pointed that out. Something that we hear less about. We hear about the health impact, but not about the economic impact. So tell us about your career path. What made you decide initially to pursue an MSPH and then later to get your PhD?
Yeah. So in terms of career path, and if folks can relate to this, I am part of that generation who works a job for 3 years and then changes. Right, I am. My dad jokes and laughs and always picks up with me about, all right, what are you doing? You keep shifting and changing. But initially, where I started off at is that I wanted to be a physician. And at the time, I actually wanted to be an orthopedic surgeon. I played football through high school, went to college on a football scholarship at Alcorn State University. My freshman year, actually, I switched from a football scholarship, athletic scholarship, to academic scholarship, because I made a C in an honors English class, and I never made a C before in my life, and it just felt very different. But I decided to, all through undergrad at Alcorn, every summer I did a summer internship or summer fellowship. So after my freshman year, there was a program used to be called, was it MMEP? But it was a program focused on underrepresented communities, students from disadvantaged backgrounds, to help and support them in getting access or going into STEM or medicine and research. So I spent my summer after my freshman year at Vanderbilt in Meharry, taking classes there, shadowing, working in the orthopedic clinic, sports medicine clinic. The next 2 summers, I spent time at the University of Rochester doing research in the lab, doing immunology research and taking classes there. And really what I was kind of landing on doing an MD PhD. I want to do a PhD in immunology and sort of be this physician researcher type person. So go through undergrad, finish undergrad, take the MCAT. But the other part of it is I wanted to be a MD and something else. Yeah. All right, so I did research again after undergrad in physiology and realized that I didn't want to do laboratory bench research. And I started thinking about, I really want to do systems work, because my brain, for me, worked in the context around systems. And as I was thinking about systems, the medical school in Mississippi didn't have dual degree programs. You would either have to do 2 years and go get a MPH or MSPH and then come back and finish, or do it first and then come back. And so as I was thinking about schools to apply for, I ended up deciding, I was thinking about MBA in healthcare administration. As I was researching, I learned about the MSPH program of health policy they had at UAB at the time. So applying to a bunch of different schools, ended up getting accepted here at UAB, and decided to come here to study health policy. But prior to coming here, I also applied to a fellowship through the Kaiser Family Foundation called the Barbara Jordan Health Policy Scholars Program. They would take students and put them in a congressional office to work on health policy issues. So I also got accepted to that program. And so I went and spent about 5 months in DC working in a U.S. Senate office on health policy issues prior to coming to grad school here at UAB. During that experience for me, I realized that I did not want to be a physician. I actually wanted to do policy work. Mm-hmm. The rationale for me at the time is that as a physician, I can impact one patient at a time, but through policy, I can impact thousands of people at one time. And so that transitioned me into going into policy, coming here, and had a great time here. All of the people I met and all of the work, enjoyed it so much and stayed to start taking my doctoral level classes. And I'll be honest, I tell this story publicly, so I can tell this here is that I actually backed into the PhD program. I was here, I was taking classes. I actually was working here at the school with regards with the stroke study. Mm-hmm. And as I was taking classes and working, my advisor at the time was like, hey, you can sit for comps. and didn't realize I was taking those classes. And I kind of looked around and went through this phase like, okay, all right, I'm gonna sit for comps. And that's kind of how I got even going into doing the PhD, because I had a lot of thoughts, right? And we'll get into this, but I had a lot of thoughts about public health, the role of public health. Even with my MSPH, we had to do a thesis. My thesis was looking at the root causes of disparities in incarceration and exploring the root causes and the disparities of health, and essentially making a case that it's all the same. Like when we get into looking at root cause issues, as I described it at the time, these sort of barrel of troubles that sort of exists in our ecosystem that influence certain outcomes in different ways. And that was really aligned to how I was thinking about policy, is going further upstream, and how do we influence root issues, root causes, to have positive effects, not just on health, but thriving communities where people can live in their full dignity. People can live in a way that is healthy, and not just healthy in the physical sense, but healthy in the social, emotional sense of what you need to be a whole person.
And the connection between that work and your current work, thinking in the context of those determinants of health, structural racism, you're still right in the thick of it. Yeah,
the career piece for me, and I've done a lot of different things, right? So coming out of even working on a PhD, I did some work around public health consulting in a nonprofit where we work with other nonprofits across the country that are trying to do programming and so more about health, some sort of program development and policy development kind of work. But about, I think November or December of 2008, I got a job working in the Mississippi State Legislature as a policy analyst. And there was also right around the same time that President Obama had been elected, and the economy was in a recession, and we started talking nationally about stimulus, about how do you infuse money, investments into the economy to help the country come out of the recession. Well, this was a lot for all of our states to get our heads around, like how do you implement this? What are the budget implications for it? So this was new sort of legislation. Well, because of my experience of working in the Senate, I was the only one on our staff who had federal experience. So they sort of gave me this project and say, hey, just track this. And this was before it became law. So I'm tracking, I'm working. What happened for me from a career standpoint, I ended up becoming the lead advisor to the state legislature in Mississippi on the implementation and budget implications of the American Recovery and Reinvestment Act. And so from doing briefings to House members in Mississippi, to Senate members, to working with all kinds of stakeholders. And it was vast. I mean, it was infrastructure projects. It was a lot of money going into the workforce. It was a lot of money going into university systems. It was a lot of investments across all of the things that we know and come in touch with. But that work sort of led to other work. I was able I actually, at a point, resigned from that job. I resigned so I could finish my PhD. It was hard to do both. And then once I finished, I was able to do consulting. So I've done reports on looking at broadband access across rural communities, and then transitioned to doing some teaching at Jackson State. And the guide for me on this work, the public health framework, the public health lens, all the things that I learned from an academic standpoint was at my fingertips to use in all of the work that I was doing at the time. So I've never sort of divorced myself to say, hey, I'm not in that space anymore. I don't do that work anymore. The reality of it is, for me, is I can't do the work that I do today without that. Yeah. And so that's been the connection for me.
That connection is so clear. So thank you for that. You mentioned your undergrad at Alcorn State. Tell us a little bit more about your experience there, and how would your experience studying in an HBCU impacted your decision to study public health?
Yeah. So I am a strong supporter of HBCUs, and I am a son of HBCUs. So the legacy for me is that my dad attended Alcorn State University. My aunts, I had a great grandfather who attended there, and so that's been something that's part of the legacy of my family and who we are, and where I'm from. I think the connection for me in connecting sort of my experiences in time at a HBCU and my time in studying or going into public health is really about, for me, is the weaving of opportunity and the weaving of impact. So one of the reasons that I attended Alcorn State University is I knew firsthand how that institution, how HBCUs have particularly impacted the communities in which they're located in, but also students who've been able to attend the universities, right, the investment. And there are certain things that I remember, like I remember being on campus at Alcorn and, doing what all college students do, right, hanging out. And at the time I was hanging out, I had a organic chemistry class. And I remember the organic chemistry professor driving by where I was hanging out and stopping his car and said, "Corey, come on, let's go to class." I'm like, "Doc, he was like, "Nah, come on." And I remember getting in the car with him and going to class and walking into class with him, right? So that kinship, that relationship. And so to some extent, if you think about it, for those of you all who may be doing work and thinking about research around like community-based participatory research, so much of your ability to effectively do that research is based upon relationships. And so a lot of the relationship learning, the relationship blending that happened on the campus at Alcorn for me worked. So even when when I was here in school at UAB, a good number of our African-American students at the time were from HBCUs. So Alcorn, Jackson State, I think Alabama A&M, Tuskegee was represented. We had some students from Spelman. So just all over the region. And even that weaving from our experiences as an undergrad, that weaving of our experiences here in graduate school at UAB continue. And even today, a lot of us still, we're in contact with each other, we talk to each other. A lot of them remember the birth of our kids. When we travel, we all connect. And we also, part of the reason is making sure that students know the opportunities that exist at HBCUs, the opportunities that exist here and come into UAB, and how do you use all of that to have direct impact in the communities that you came from, the communities that you have opportunities to touch and invest in, and really just have a good sense of connectedness to community and investment in those communities.
Fantastic. You mean you'd sit in the same room with someone from Jackson State?
I did. I did.
I joke because that's
our
biggest
rival.
Biggest rival.
Yeah, it's like the Alabama State, Alabama A&M Magic City Classic game that happens here.
I tease you with that. Tell us a bit more about your experiences when you were a student here that helped you be successful in your career. You mentioned that as a student you were you were working with the regard study.
Yeah. Look, I had a lot of fun as a student here. I'll tell you, because I felt like I had an opportunity to do whatever it is I wanted to do, aligned to what I wanted to do in my career. One of mine, we were talking about this earlier, Dean, one of my mentors or advisors here while I was a student here was Dr. Max Michael, former dean, who used to be here at UAB. I remember I mentioned that my thesis study was looking at disparities in incarceration and disparities of health. Because I had an interest in that work, I think the previous semester I was able to invite with the school, and because of the school, invite a researcher from Hunter College, Nicholas Fraudenberg, who was doing a lot of work around disparities and around incarceration and all that work, to come and do a seminar here, right? So, I think as you come in, as you're figuring out, I feel like we say like, hey, we're gonna go study public health, and we go study it, and then once we start studying, we're still figuring out what it is we're studying, what it means, because it's a very diverse field, right? And you can do anything that you want to do in it. And then at the same time, you got to figure out like, where's the space that appropriately fits who I am and how I want to show up in the work. And so for me as a student here, I was able to figure that out early. For me, yes, I was interested in work or the research and work around health disparities, whether it was hypertension, obesity, diabetes, like all the work, cancer disparities. And at the same time, what I was more interested in is going further upstream. And so I was allowed to be able to do that here as a student, to explore what that looked like, what it meant, and make the connection to the work of sometimes when we think about, I hate to use this word, but traditional public health. Because I don't think there's traditional or non-traditional. I think all of it at the end of the day is public health. I got involved early also. So in addition to working here at Regards, I had an opportunity to be adjunct faculty in the African American Studies department here, where I taught a issues in public health class in African American community. Early on, even it was the school itself was a sense of community, right? A sense of being in class. Like our classes, at least the classes I know I was in, were active debate and active discussion classes. Like we didn't have students, it wasn't an experience of just coming in and just say, hey, we here, we want to push through and get the degree and keep moving. No, it was students showing up for active discussion about what was happening, the issues of the day, how are they impacting communities, how it's impacting health. And you could pull from everything, right? You could be in a class and have a conversation about W. Du Bois, who was a sociologist who did early research around health disparities. And in his early research even called out, like, there's these things out here, there are environmental factors impacting health. And we could be in the class and wrestle with that, right? And what does that mean? And you could be in one class and you have different perspectives. You could have the biostatistician, the epidemiologist, the person who's looking from a health standpoint, somebody who's thinking about it from a behavior standpoint, and just wrestle with that in class. And so for me, getting in here, having a good community of people that existed here, but being involved with, I was involved with the Black Graduate Student Association here on campus. There were a lot of other students who were previously involved who really just created a sense of community even coming into the door. So there were a lot of things that were happening, I think, for me as a student. It just supported my development.
Fantastic. So let's sort of take a pause. We have more questions, more things to discuss, but we can take a pause and see if there are questions that any of you have just at this point. Oh, we got one over here. Go ahead.
You mentioned in your thesis social and emotional aspects. Did you find that there was a space here for mental health, behavioral health aspects?
Yeah, I did. I mean, just from my experiences or research or just discussions we were having, because it was, I mean, and that was the thing. I think the environment that we had here was open to everybody to be in conversation and relationship. The other part of it is, and we talked about my experiences attending a HBCU, right? And even from when I think about my experiences growing up, even if there wasn't room for it, we were going to make room, just to be honest. Because I remember at a time, a group of us at the time was talking to, I think Dean Michael at the time, was about the need to increase the number of faculty of color at the university so that the faculty is more representative of the students who were here. And we were in like active communication around that. Also, how did we diversify the school with more students of color? A couple of us who were students here even volunteered, and I think we did it a couple of times, to go to HBCUs to help recruit students for the university. Because we just knew it was value in diversity, it was value in voice. Because ultimately, and this is so much of when I think about work, we always are trying to learn and assess and approve, right? So if we're doing a good thing as a university, that's great, but we can always do better, right? And so I think we had space to be who we are, to talk. We had a lot of space to bring in a lot of different discussions, even into our classes. And so I don't think there was any place in at least my university experience where I felt like we were bumping up against guardrails. And I'll be honest, we very well could have been and just didn't care. Just because, you know, this field in itself, the way it works, the way it's designed, how we pull from other disciplines, creates just innate diversity in it. And we always got to be thinking about how do we push those boundaries. Because ultimately the communities that we serve, even the communities that I serve in the work I do at DRA, that's what they need us to do, right? I just don't, like if we're not talking about how the work that we do connects to the people that we are supposed to be serving, whether it is thinking about health outcomes, health disparities, mental health, behavioral health, I don't know what we're talking about. Like, why are we here if we're not talking about doing that work? And that was my attitude as a student here, and that's really the basis of the work we do now is, like, let's be focused on the things that we got to do that matter.
Well, pushing boundaries, it sounds like something that's been a running theme in your career. Tell us a little bit more about your time as executive director of the Mississippi State Conference of the NAACP. I'd like to hear more about that work.
You know, that I would say to date, that's probably been one of the toughest jobs that I've had. And tough from the standpoint of you know, sometimes in our work in our spaces as knowledge-based workers, we can get divided from or divorced from some of the everyday realities that people are experiencing on a day-to-day basis. And to sit with parents and children to understand and see the direct harm of how the criminal justice system are impacting families, how not having access to health care that's based upon political decisions are directly impacting people, and then to do that work when the organization that you're leading doesn't always have all of the resources that you need. But through the ingenuity of the organization and relationships, you still work to do the work that you have to do. NACP was interesting work. I mean, just because I was working there, leading the organization as ED during the pandemic at the same time too. So you have crises all across the country and crises in communities and family, housing, food insecurity. You, on top of it, struggles with our criminal justice system. Folks still struggling to fight to have a family-sustaining wage. And you're doing that work and thinking about those issues every day. And at the same time, knowing that by doing that work, there are threats against you. I remember getting a threatening email against myself and my family for somebody where I had to go and do whole FBI sort of things where we did briefings about what were the threats that were going on in the state, in the country, how it directly impacted us, not only from a work standpoint, but me from my personal family. I remember some stuff I was doing on social media. We were doing a community event, a community town hall, and my middle son, I have 3 sons, my middle son at the time was there, and the camera person was letting him play with the camera, did a little story. But I remember, like, my son getting attacked on social media by somebody, right? So on one hand, there's the work that you do and trying to support community to try to move towards equity. And there's also the part of the work that is also very personal, right? And so for me, when I work in spaces, the work for me is very personal. The work at DRA is personal for me. My work that I did at Hope on policy work has been always very personal for me. But even in that, we have successes, right? Matthews, who's part of our team here, actually worked as a community organizer with me when I was at the NAACP. And I remember there was some work around criminal justice system, the big pieces around DA accountability, because the district attorney is actually one of the most powerful sort of players in the criminal justice system. They determine, if you decide to charge somebody or take something to trial or not. They make sentencing recommendations. They can determine if you're going to sit in jail or not, versus they are very important players. And so we did a project in Mississippi at the time focused on DA accountability. And in Southwest Mississippi, there had been a district attorney, had been there for years, had longer than average times where citizens who would sit in jail without even going to trial. Some of the sentencing recommendations were a little harsher than other areas. And so we brought light to that and did a 20,000 door knock campaign to raise issues around DA accountability, the importance they play in the system. By raising that awareness, what ended up happening is in that following election, that part of the country elected, the part of the state elected their first African-American and first woman district attorney in the history of that region. And so when you look at those efforts, they have direct impact on places and communities. That's the work. And I had to still do the work of fundraising. All right, so if you do work, you gotta raise money. So I gotta do the operational stuff of the organization. But that it brought me a lot of joy. It was a tough job, but I wouldn't change the experience. And how I thought about and processed the work that we were doing. So if we go and do organizing in the community, that's community-based participatory. All right. What was unique, and I'll say this, because unique about it is that you could take what we learned in community-based engagement, what you learn in theory around like social change theory, what you learn like sociological model, like all these different levels. You can take all this stuff that you learn in theory and in practice. At the same time, I had the opportunity to engage and talk a lot with members of SNCC, the Student Nonviolent Coordinating Committee, which is a historic legacy civil rights organization. Did a lot of work in Lowndes, Alabama, did a lot of work in Mississippi. And their organizing model, SNCC's organizing model, was one that was based upon community. Essentially what they did was they took people in the 60s, students, moved them into community. They lived in the community, found community expertise, found people who were invested in their community and supported them in their development. So recognizing expertise in community. So you think that was a real model that was used for civil rights organizing. You think about all the stuff that we learned in the context of public health and engagement. It's the same. It is the same. So on one hand, to be academically trained in the work, but also to do it from an organizing frame, and to talk and engage and get mentored by people who did the work in the 50s and 60s. There was no better place for me to understand what it was that we learned in class and how it applies to not only in the context of health, but how it applies in the context of civil rights. So that was the work of NACP that I had the opportunity to really experience.
I'm so glad that you showed us this connection between the work of civil rights from 40, 50, 60 years ago and what public health, particularly community-based public health, is about. It's part of why we believe it's so important for our students here at UAB to know something about this history. And so part of what we try and do is at some point during students' time here, take students to the Birmingham Civil Rights Institute, take students to the Legacy Museum, not only to re-emphasize that history, but again, to connect that history to what it is they're doing today. So thank you for shedding light on that.
You can't divorce that. It's all mixed up together. I'm from Mississippi, but if you're from Louisiana, you got gumbo. Once you have gumbo, when you put it all together, it just tastes good. You can't pull one part out. You mess up the gumbo. I mean, so all this stuff is all together. I mean, I take it from a healthcare framing, right? Even when you had Freedom Summer that was happening across the South, a component of Freedom Summer included the work around healthcare and healthcare organizing. So when you think about stalwarts who were folks like Alvin Poussaint, who was SNCC, was part of Freedom Summer. He was a physician. When you think about Dr. Robert Smith, who's still living actually in Mississippi, one of the early and founders or early innovators around the FQHC model that we now know today. With one of the first FQHCs being founded in Mount Bayou, Mississippi, and that FQHC still exists today. These folks who were part of civil rights movement who went on to become physicians, pharmacists, dentists, who formed, if I'm not mistaken, was the Medical Rights Committee, Human Rights Committee, which was the medical arm of Freedom Summer, that if you trace its lineage and history, actually was part of some of the remnants of when we look at today around how you think about the Affordable Care Act and Medicaid expansion. Like it traces its roots back to the 50s and 60s. Or when you think about the fact that, and this is in one of the textbooks that talk about this, the early sort of HMO sort of model, right? One early example of an HMO was based upon a hospital in Mississippi called the Taborian Hospital in Mount Bayou, Mississippi. What they did was, and this was a community, all black, all African American community, in order to build a hospital, this group called the Knights and Daughters of Tabor, fraternal organization, went around to communities asking for donations and money to build a hospital. In return, they offered them so many nights in the hospital and certain types of care in return for their donation. That model in itself was recognized as an HMO model in creating that contract. So, and as you can see, I like history and the connection between this and civil rights and the work we do. But I'm bringing it up to just emphasize that if you're gonna do, I think if you're gonna do public health, and if you're gonna do public health that is community-based, anchored in people, anchored in place, these are the types of things that you have to delve into and dig into to understand context, because that context helps you to address present-day problems and present-day challenges. And it helps you to foresee and forecast what's on the horizon. All right, so that, to me, that piece of studying that, learning that, and understanding it and doing it, combined with academic experiences, I think essentially is part of the roadmap of how we do this work, how we do it effectively and efficiency, without losing sight that we got to keep people centered in the work. Because if we lose people in it, again, I'm one of the ones that we lose people, I don't know what we're talking about. And it's hard for me to go down those paths if we're not talking about people at the center of the work we're doing.
Fantastic. Let me pause again and see if the other questions have come up over the last few minutes. Ebony?
So I can imagine throughout your career you've met so many impactful and iconic civic leaders, corporate leaders, community leaders, political leaders. Who is the one that left you the most deep? The one who impacted you personally the most?
So that's a setup question, right? because there's been so many people. I'll talk about two. One, most recently, Hollis Watkins, who recently died 2 weeks ago at his funeral. He was one of the early SNCC members who was in Mississippi, because a lot of SNCC folks came from universities like Howard and others and came to Mississippi. But SNCC was Hollis was one of the folks in Mississippi. I remember, and this was been on my mind more recently, I remember a conversation I'm having, and this is when I first came into the role at NAACP. And if you ever worked in legacy institutions, whether it is any institution, where you're having to navigate intergenerational challenges, right? When you're the younger person coming into the space and having to navigate a lot with elders, and how you figure that out, and how do you figure it out in a way to sustain the institution. I remember this conversation with Hollis, and he gave me this example. He said, you know, if you got two people and both of them have a light, and if you have the light of somebody who's one of our elders and they walk into their room, their light is still shining. He said, but if you're a younger person and you walk in there with your light is shining, but it's just a little bit brighter. And what happens sometimes is that your bright light may have people turn to you, right? So he's giving this lesson about this, right? And he was talking about even, and Hollis is older, and even in that transition, he said, but you treat it and you do it with dignity and respect. And he said, he used himself as his own example. He said, you know, he said, run under me, run around me, just don't run over me. He said, even if you have to pick me up and set me aside, that's okay. Right? So that advice, right, from him, and so always in awe of how he delivered what you needed to hear in a way. Another person is no civic leader, no whatever, is going to be just my family, right, in general. But I always frame family in the context of an example about my grandfather, my grandmother, particularly my grandfather, is I went to Alcorn, I got a BS, I went to all these other schools, UAB, MSPH, and PhD, but my education came on the side porch of my granddad's house. That's where that came. So taking those experiences and those learnings for me, and bringing them into all these spaces that I occupy, is really the thing that wows. Because the thing that wows me is that when I look at the community I'm from, where I grew up at, and all the knowledge that people poured into me then, and how relevant that knowledge is today in the spaces I occupy.
Thank you for that. So for current students here at the School of Public Health who may feel unsure of their future goals, how would you encourage them to explore possibilities?
Yeah, the first thing is to be open to the possibilities. So often we look at what we want to do and say, I want to do this. As one of my other mentors say, as high functioning people. As high functioning people, you say, hey, I'm going to do this and I'm going to go do it, right? I'm going to do it. And then sometimes you get so busy doing it, but you lose process, you lose experience, you miss all the other important stuff is actually that can be helpful to you in really figuring out where you're supposed to be. So I had to make a choice early on in career for me, being in Mississippi, wanting to do public health, wanting to have a career that's family sustaining, and really wanted to stay in Mississippi. So, right, had opportunities to leave, but I wanted to stay there and live there. And depending on the state you're in, the place that you're in, you know, it can be a struggle sometimes to find, right, family sustaining wages in public health. And so what I decided to do is for me is that I just decided I believe in me. And what that meant for me, though, is that figuring out not necessarily what I wanted to do, but figuring out how I wanted to feel. All right. And that's a very different approach, I think, at least I'm learning, and how we often talk about who we are and what we do. You know, so often we just like, you know, I do this, I'm X, I'm this, and this, and that. I could care less about titles and stuff like that. It just don't mean a whole lot to me in that way. But as I sort of figure out career for me is figuring out how I want to feel and where I want to feel it at. So what I would say for students who are trying to figure it out, you know, instead of getting into, and I know it can get challenging because particularly if you got folks around you in your orbit and saying, I'm doing this, I'm doing that, I'm doing that, that may be good for them. It may not be good for you. So you got to figure out what's best for you. And so the question I would always ask is how I want to feel. Now I had to learn to get to that point to figure out that's actually the question I need to be asking versus about what I wanted to do. Because if I'm asking myself how I want to feel, that actually opens up possibilities for me. Because if I say I want to do this, I'm automatically limiting my possibilities. If I ask how I want to feel, everything is on the table, right? I'm open to what's coming at me. And when things come at me, I then go through my analytical process to figure out, is that the right place, the right space? The other thing I would say is that for students is, because, and I just had this conversation with a student last week, some students in this space know I want to be an epidemiologist, right? Which is good. Some folks know I want to be a biostatistician. But there are some students who's like, I like what I'm studying, I like what I'm learning, and I still don't know what I want to do. All right. For those students, what I would say is, one way that I use that is that I look at my skill sets. So based upon my experience at UAB, there were certain skills I developed, right? Quantitative analysis, analytical analysis, being able to read to understand different disciplines, being able to take theory into practice. Those, not afraid of data, right? Those are skill sets. Everybody don't have those skill sets. You're unique in the space that your discipline allows you to dabble in all these different things, and you can figure out what's your sweet spot, what makes you happy. Data makes me happy. Maybe program development don't make me happy. Digging into policy and law makes me happy. Maybe disease tracking don't. But you have the opportunity to figure it out, and you develop certain skill sets. And so every time that I've moved through in and out of career spaces, I've used my first job as an analyst in the state legislature. They didn't have anybody in public health background. But when I walked in the interview, I said, I have a skill set that can allow me to understand law and how it moves into practice. I can analyze data and interpret data and synthesize it in a way where communities can understand it. In that case, the community was lawmakers. All right. So I would say look at your skill sets and what you have, and then start playing with those skill sets as you're looking at different job opportunities, if you're looking at different spaces you think you want to be in, and try to align those skill sets to opportunity. For me, I've been much happier in doing it that way versus nailing myself down to say, I have to do health policy. When the reality of it is health policy isn't all policy. It don't make sense to me to just say, I have to do this, or I have to do that. I open myself to possibilities.
Yeah. Not figuring out what I want to do, but figuring out how I want to feel.
Mm-hmm.
Remember that one. Remember that one. Ebony, we've got just a couple of minutes left. Sarah, do you see any questions from online?
No, but if we have time, I selfishly have a quick question.
You've got it.
That's sort of in line with what you've already been discussing, finding value in those experiences, being open to those experiences. A lot of times with our students here and students in general, when you are finishing your degree and you're looking at opportunities and you can't find something that is exactly aligned with your degree, right? Of course, collectively we encourage finding, any experience that you can learn and grow from. So I kind of want to flip that back on you, looking back through your experiences, maybe some that didn't land on a resume that might be surprising, that still gave you some experience.
Yeah. Well, I'll say a couple of things about that too. As you are navigating, right, career space, again, and I go back to, a lot of times we have to deal with these external pressures, right? And I'll say sometimes those pressures are very real in the context of, I need to eat and I need to support my family, I need a job, right? When I was working on my PhD or doing my time here at UAB, my wife was in dental school in Mississippi. So I'm getting ready to transition back to Mississippi. She's going into her 4th year of dental school, and we're also expecting our first son. So that was I got to support my family, right, decision, right? And so being able to walk in and get and start working in the state legislature, I had to sell my skill set because I needed a job, right, to support my family. Those skills And once I got settled into it and the work that I did, started to come full circle of how I can use this as a leverage opportunity. All right? Because there will be some opportunities that you will take out of necessity, but you also got to figure out what's the leverage opportunity in the space that I occupy. One of the hardest things I think for people who are achievers is to be still. All right? But what I will share with you is that if you're an achiever, and if you go into a job and you're still figuring out the impact and opportunity in that job, being still for an achiever is an active stance, because you have to actively be still. And if you're actively being still in those spaces, use that as an opportunity to learn. Because what it is creating is you, whether you are learning from those set of experiences on that job, whether it's the social emotional work that you do and learning to work with colleagues and people and institutions and structures and hierarchy, whether it is the interpersonal stuff about whether you have to learn how to lead through actually leading people or lead through influence, which is two different things. Or it may create an opportunity for you to go and just do other learning on your own in other spaces. But you're actively being still, because what you're trying to do is make the most of that opportunity, even if it's not the space you want to be in, so that you can transition into the next opportunity better prepared. Things that don't show up on my resume or things that I've done, talked about the fellowship opportunities. One of the things I did, for me, learning is important. So did the Kellogg Fellowship, which was a learning opportunity. I had an opportunity to work with an executive coach. I've had an opportunity, look y'all, I went to the mountains in New Mexico and did a silent retreat for a week. I do all kinds of different things, but there's a reason. For me, years ago, I started this and on this journey about what does sustainable leadership looks like. The reason I went on this journey is that for me, myself, I'm having to lead institutions, lead people, lead organizations. I have a family, I'm a son, I'm a dad, I'm like all these things. So right, think about your whole self, your whole person. And in most of those spaces, you show up and you want to show up and be present. In some of those spaces, you may be leaders, some of those spaces, you may be followers. And a lot of times you're interchanging between it. But how do you sustain it over the course of a day? How do you sustain that over the course of a week? How do you sustain it over the course of your career? I believe it just don't happen. I believe you actually have to practice and study what it means to sustain leadership. And so part of my leadership journey has included meditation, silent retreats, spending time just thinking about leadership, the different types of leadership, how you show up. And so even when I was talking about like being in places and actively being still, that's stuff that I've had to practice, to use, to learn. Oh, there's a space that I want to go into career-wise. What am I missing? Oh, I'm missing understanding organizational culture and change strategy in institutions. Let me go learn it right here while I'm here. I go and learn it. I'll bring it back. I see the opportunity. I'm going to jump into that opportunity because now I got what I need to help me excel and to help me to be better positioned to do the work I need to do in that space. So I think every opportunity is a learning opportunity. I wouldn't look at and say, hey, you may take this job, it's not quite where you want to be. If you're an achiever, to be in that space and be still, that is an active stance. It's not a passive stance. So take advantage of that time while you're being actively still to get what you need that's going to support you into that next transition.
Great. Well, Dr. Corey Wiggins, thank you so much for this wonderful time, this wonderful conversation with you. Your alma mater is extremely proud of and for you. So please join me in thanking you. Thank you.